This best practice advice for physicians on the use of cannabis and cannabinoids for management of chronic non-cancer pain is important because cannabis use for medicinal purposes is growing, but clinical advice is still lacking. Physicians are in a unique position to counsel their patients about available treatments for pain management, including the evidence related to benefits and harms, so that patients can make informed decisions. ACP advises that physicians counsel patients about the benefits and harms of cannabis and cannabinoids when patients are considering whether to start or to continue to use cannabis or cannabinoids to manage their chronic non-cancer pain. The advice is for young adult and adolescent patients, patients with current or past substance use disorder, with serious mental illness, and frail patients and those at risk of falling. ACP suggests that physicians advise against starting or continuing to use cannabis or cannabinoids to manage chronic non-cancer pain in patients who are pregnant or breastfeeding or actively trying to conceive, and against the use of inhaled cannabis to manage chronic non-cancer pain. For context, cannabis use for medicinal purposes has grown among patients with chronic non-cancer pain. As of 2024, 24 states plus in the US plus the District of Columbia have legalized cannabis for adult recreational and medicinal use, and it is legal for medicinal use only in an additional 14 states. ACP wants patients to know that they should look to their doctors to provide sound scientific advice about the use of cannabis for pain management, rather than laypersons like dispensary workers. For many patients, evidence suggests that the known harms of cannabis and cannabinoid use outweigh the potential small degree of benefits to ease chronic non-cancer pain. Additionally, cannabis can be addictive, even if being used to manage chronic non-cancer pain. Another challenge is that in most US states, patients still obtain cannabis for chronic pain through a dispensary with less medical oversight than they would receive for FDA-approved medications.